Thank you so much, Phoebe, for jumping on ADHD Her Way. So nice to have you here.
Thank you so much for having me. It's nice to finally chat to you.
Wonderful. So I'll just introduce you to our guests and then we will jump into a set of questions. So Phoebe jumped straight into study after high school and has been a clinical psychologist since 2011. She holds a Master's of Clinical Psychology from the University of Wollongong. And while she embarked on her career as a psychologist, her life and relationships unfolded and revealed her own relationship struggles. Like many of her clients, she struggled in relationships and felt that her training was not sufficient to help overcome these struggles. She was also working with children and families with neurodivergence and wanted to be more helpful to parents and couple system. She went back to study and completed a graduate diploma of relationship counseling. She now sees adults for individual and couples therapy, and neurodiverse couples work is a big part of her practice. Her biggest love is helping women heal old wounds and learn to support their inner child to help them find and keep love. Wonderful.
That's
How exciting. So it's so nice to have someone like yourself come on, because I know that so many people, ADHDers and otherwise, struggle so much with understanding relationships really well. And I guess the intricacies of it all, it's not as straightforward as just two people being kind of themselves in a relationship and just never coming across any hurdles. So is that kind of part of reason why you've found it so interesting to work in a niche? Or you tell me, please, kind of what appealed to you to it so much?
sure. Well, I think the niche happened accidentally. I think clients started realizing that I'd had a background working with children with autism spectrum, with ADHD, and then helping that family system and couples. And now I've actually realized, I just think accidentally, because these couples are running into trouble because of their symptoms and presentation, that probably at least half of my caseload would have neurodivergence in one or both of the couple.
Wow,
Yeah.
that is a lot, actually. Yeah, that
Yeah.
is quite incredible.
It just kind of struck me, and I guess I've gone and, been to an ADHD conference recently, and I just started kind of reviewing all my cases. I went, wow. And of course, they're running into trouble, right? Things like emotion regulation, challenges being present, not being organized for a partner.
Mhm.
Partners kind of clash around these things.
Yeah.
So, and it's a beautiful population to work with. Like, there's so much heart, energy, big ideas, so much wanting to work on that part and have happy, loving relationships. Yeah, I love it.
Yeah, that's great. It's so amazing that there's people like yourself out there, because I do struggle to find
Mm,
like neurodiverse,
mm,
informed, and affirming practitioners who are couples counselors. Like, they're pretty rare to
mm.
find. So it's great when you can come across someone like yourself who has experience coming from that angle.
Yeah, I think it helps. It's kind of clients come in. I think there's a relief. Like, I don't have to re-explain everything. I know that you know. It's just,
Hmm.
it speeds up the process. It's good for them.
Yeah,
Yeah,
makes them feel comfortable from the
I
start.
think
Yeah.
so. Yeah.
Yeah, wonderful. And in terms of that connection with ADHD and relationship difficulties, why do you think it's important to address them together?
Because it's a both problem, right? It's not, I know maybe you'll ask me this at the end, but there's a beautiful book, The ADHD Effect on Marriage. But this
Mm-hmm.
applies to any couples. It's a both problem, right? It's not just the ADHD partner. It's how the partner is responding to those symptoms, like often with frustration, often with anger, disappointment, hurt. Their emotions are also dysregulated, right? And
Mm-hmm.
so it has to be a both.
Mm-hmm.
Absolutely.
Yeah.
And the both is then, a partner needs more compassion, ideally, in the psychoeducation and the understanding. But then, the person, the partner with ADHD also has things to work on. But I think that team and non-pathologizing approach really helps. And
Mm.
it's the only way it'll get better.
I
Yeah.
totally agree.
Yeah.
Thank you. That's so important to have, I guess, both be very aware that this, perhaps diagnosis or combination of diagnoses exist
Mm,
in both, even perhaps, and what each other's strengths and struggles are in the relationships, and not seeing it
mm,
necessarily as a need to pathologize
mm.
beyond, maybe having that description and a way to label things effectively.
Exactly. I think to just call it, and when people get the diagnosis and then these are my challenges with that, and this is how it's going to look in the relationship,
Mm.
right? That I am
Yeah.
going to have problems with emotion regulation. Sometimes I'll forget things.
Yeah.
Sometimes I won't follow things through for you. I'll really, I'll forget things. I'll drop the ball on tasks. Sometimes my emotions will be all over the place. I won't always be present. And then you can just, as a partner, not personalize it.
Yeah, amazing. Okay, so what does an ADHD diagnosis mean in the context of attachment and romantic relationships? How do you feel
Yeah.
it kind of changes your treatment approach?
I just think my treatment approach, this has kind of happened naturally, but I'd say there's a lot more kind of in the education phase, the
Mhm.
psychoeducation. If there's a non-ADHD partner, actually, this is how ADHD works. This is, when you're saying your partner is doing these things, these are actually the symptoms of that condition. Those are the challenges. So we stay in that phase a bit longer, I would say.
Mm-hmm.
And point that out to really, provide the education, the understanding, because then I can build the compassion,
Yeah.
definitely. Also, lots of knowledge around attachment theory and what the meaning of those ADHD symptoms are for the other partner.
Mm-hmm.
So attachment is huge. And in terms of couples therapy, that bond and connection is what I want to restore for a couple. And so if one partner's not meaning to, but forgetting things or is distracted or is off daydreaming, often for the other partner, that can feel like, are you there for me? Do I matter to you? Can I rely on you?
Yeah.
We need to talk about that thing that I can't get your attention. And so their attachment and their bond and their connection can become really eroded because of the symptomology and the presentation itself, right? So yeah, they're at greater risk of couples challenges for sure.
Yeah, yeah.
Yeah.
Okay. No,
Yeah.
you explain it so well. Thank you.
Oh,
I hear that often in the clients I work with as
yeah.
well, whether ADHD or not really. But yes, I hear, especially amongst ADHDs and autistics, around this kind of mismatch at times, the frustrations, especially both people within the relationship are neurodivergent. It seems that
Yes,
that's even more likely. Do you find that as well?
I do. When I was thinking about this, I find like those couples where there's both that have a level of neurodivergence, that I probably trigger them more and they trigger themselves more, that kind of sensitivity. And then there's also this part, well, I'm managing those things or I'm managing that part. Like I've worked on being present. I can get the house chores done and out of the way. I prioritize that. I run like a motor. Why aren't you doing that? Right?
Mm-hmm.
Or I'm regulating and I'm putting my phone down. Like, how come you're not? So there's this tit for tat. And then there's this kind of, I can trigger sensitivity, I think, more easily in those couples, because part of couples therapy and how I work is the accountability stuff. So
Yeah.
I have to hold up the impact of a partner's behaviors and what that means for their partner and what it does. And that can be so hard to hear.
Mm-hmm.
Right. And it can send people into this spiral of shame and feeling bad and not good enough and a worthless partner. And will I ever be good enough? And then they might actually withdraw from the therapy. So it's often a bit tentative. But what I do often find is the repair is acknowledged. Like if I can go back in there and say, I'm sorry, I did say it in that way, and that must have been really hard to hear. And I know it's really hard to hear this feedback from your partner. And of course, that really hurts. And that hurts because you care.
Mm-hmm.
Right. And then bring it back in. You're hurting because you care and you don't want it to be this way.
Yeah.
But I'm generalizing. Often I find this population like so forgiving, kind, willing to do the work, wanting to be good, wanting to be better. Yeah.
Yeah, no, I hear you. It's a tricky minefield by sound, but very rewarding at the same time when you can get some
So
traction.
totally. And I don't know if you feel the same. I do. That's a great description. Probably is a minefield. Like it's a delicate balance. And it's like, oh, I'm calling out this behavior and this behavior is part of your condition. And I think, clients can feel really shamed by that. It's really, really tricky. But I think most of them know it comes through care, right? And we all do stuff, right? We're all
Yes.
human. We're all going to make mistakes in relationships. We all hurt our partner accidentally.
Mm-hmm.
Yeah.
Yeah, when you can bring that self-compassion to the forefront and have that person start to resonate with that, so that there's humanity in making mistakes and forgiving yourself. It can be
Totally.
such an important thing. But yes, the RSD element I heard in there, the rejection sensitive dysphoria, is such a big feature for ADHD, as even though not
Yes.
clinically recognized necessarily, well, not in the manual, but I
No.
do think that you probably see that plenty when you're working with couples.
I'm sure I do, and I don't think I realized it or I didn't have the name for it. So, I mean, thank goodness we have the name now because I can go, oh, I've triggered the shame, right? And
Mm-hmm,
then
mm-hmm.
the behaviors are like, pulling away, withdrawing, kind of feels like the inner child's in the room. And yeah,
Mm-hmm.
to really be able to validate that is important.
I love that. I
Yeah,
love how you just refer to. I think a lot of people can probably relate to that feeling of that young version of themselves coming out all of a
totally,
sudden.
totally. And they're
Mm.
panicked and overwhelmed and they're hearing bad things about themselves. We know they were kids once who went to school or had friendship challenges and were hearing really not nice feedback about themselves. So, yeah, of course, they'll be triggered.
Yeah, yeah, whether that's in the relationship itself or once sitting in the
Mm,
therapy room and
mm,
hearing once again that they're kind of, in their head mind, maybe stuffing things up and yeah,
totally.
failing at something else. Once again, that I can understand would be quite triggering in that sense. And so, yeah, you mentioned that the way they work with RSD is by kind of validating their experience and that recognition of, okay, this is what's happening here. Can we bring
Mm.
some compassion to it? Is that right?
Yeah, absolutely. And, I might have to stay a bit longer in the compassion and the validation and the empathy, and
Mm-hmm.
then also name it for the partner. Maybe you've said things or offered feedback to your partner. Has this process actually happened at
Mm-hmm.
home or in
Mm.
conflict? And
Yeah.
how have you managed that?
Mm. Yeah.
And then, the thing about that becomes problematic. If that person's shame is triggered and activated, their partner's kind of left hanging. Like, I wanted to talk about something. I had some feedback, something was bothering me.
Mm.
And now they feel like they can't finish it, right? Because
Yeah.
the shame is being triggered. It's really tricky.
Mm.
Yeah.
Yeah, it's so interesting. I think back on the times when maybe I was not diagnosed, although my partner is extremely supportive considering like the fact that I am maybe much too chaotic to his king, but uh, we kind of complement each other. I often refer to him being kind of the cleanly one and myself being kind of the cook and that, the creative one perhaps. And so, and pushing, and the one pushing, I guess, him out of the comfort zone. But there is always
Totally.
that element of like, yeah, when I've forgotten things on my to-do list or like I have left cupboards open or, put things away, like we had discussed, or paid the bills on time. Like there is that element still of shame that comes. And I guess
Mm.
I've gotten better at not feeling the need to over apologize, like taking responsibility for the things I do feel
That's
like I need to take responsibility for.
And that's what I think that's beautiful. Like, once is enough. I'm sorry, I didn't mean it. This is how I'm working on it. Yeah. Don't have to over apologize. That makes yourself feel worse.
Yeah, yeah. So that's, I
Yeah.
think, what I often tell clients as well is recognizing maybe sometimes there's things that you feel you should have changed or reminded to do and is impacting others in a
Mm,
negative way, like your partner in a relationship. And if that goes on, like it can, of course, create cracks, and then the cracks can
mm,
develop into, I guess, bigger problems if not
mm,
addressed. But they are also responsible for, I guess, supporting you in a way and being like, okay, let's review. If you are
mm.
finding yourself so much struggling with this mental load, like, is there something I can do to help you, as opposed to, yeah, you should
Totally.
be doing better. Like, that's not a very supportive
No, because
partner.
then I think the part of the shame and the part of the struggle is you keep quiet and you don't ask for help.
Mm,
There's this thing like, maybe everyone else is doing it. I should be able to do it. So then you silence and then you struggle
yeah,
more.
yeah, suffer
Yeah.
in silence.
Mm,
Yeah,
mm,
you hear that often as well.
mm,
And I know it's a bit of a gendered conversation. Do
mm.
you find too that often if the female is the one who has the ADHD and the male doesn't,
Mm.
that there's a great mental load on that female, and maybe
Oh,
they're struggling somewhat more as opposed to the other way around, like a male with ADHD
yeah.
who has a partner who can kind of pick up the slack. Do you find
And
that tends to be less
yeah,
obvious then?
yeah, absolutely. And because again, it's gendered, but I think there's huge truth in all the couples I see that a woman would take on the majority of the mental load.
Mm,
Even if she has a caring, loving male partner, again, it's that self-silencing. She
yeah.
doesn't know how to ask for help. Maybe she doesn't believe she can be helped, or she rationalizes it. He's got a lot on his plate. And she's always probably masked, right? I think masking is particularly strong in females, particularly, the inattentive ones who there's been feedback for being good and perfectionistic and silent.
Mm-hmm.
And so I think, yeah, absolutely. There's that
Mm,
kind of role that she takes on, and she probably suffers more.
yeah.
Yeah. Yeah.
Yeah, I've definitely felt that, and myself and my partner have
Mm,
worked at that for some time, trying to figure out a good system, and also running a business, and then also, raising two kids, and
I know.
all those different things. It has meant for a few reviews over time, because things have definitely changed in terms of intensity around our busy schedules, and we're still
Totally.
finding ways to manage that. I know that I was invited to a shared calendar approximately 6 months ago, which I still have
Oh,
sitting in
yes.
my inbox. Just
But
classic things like that.
might feel more overwhelming, right? Then you have to face it, right?
All better. I think I just got to a step, and I didn't have the
Mm,
information to then finish the actual
mm.
sharing. So I might have to go back and revisit that. But yeah, I mean, there is things like that, those types of tools that do help the
I
pressures and
think,
the
yeah.
communication, right? Like, it prevents those things from slipping, and
Mm,
both of you
mm.
working in silos more.
Totally. Yeah. And often, well, a couple I'm working with at the moment, they say structure. Structure is going to be the key for us going forward.
Mm,
It is. And it's not sexy and it's not fun and it's not easy, but it's the way it's got to be. I think
yeah.
it's
Yeah.
kind of, yeah, that's part of having conditions, isn't it? That we have to apply these tools.
Yeah, structure and routine is good for us as human beings, even though the ADHD tends to fight it and kind of
Mm,
still want an element of, I guess, novelty and excitement. But having, I
yes,
guess, a baseline or a foundation of, a decent routine where possible is ideal, especially when you have a family to raise, for
totally.
instance. Mm.
Totally.
Okay, now what are some common misconceptions about ADHD that you've encountered, and how do you typically address them? And is there perhaps an overlap with couples therapy there?
Well, I don't know if it's misconception, but I just think it's underestimated how much this contributes to a couple's challenges.
Hmm. Yeah.
Right. So yeah, I've started to do I just screen everyone for ADHD actually.
Mm,
I just
mhm,
almost,
mm,
okay, you're coming in for couples therapy. Let's try and figure out that part out first. And I might have cues or bits of information, but
mhm.
I don't think those worlds merge really well. Like
No,
understanding neurodivergence, ADHD, autism spectrum, and couples therapy. I don't think we've come far enough in that.
no.
And I think a general misconception, and it's not necessarily about couples therapy, is that ADHD is overdiagnosed,
Mhm, mhm.
right? And that I could speak about this all day because it gets me really angry and really upset. And I
Yeah.
think it's really wrong. I think it is the condition that is probably the most poorly understood by our profession and other professions as a whole
Mm,
in the helping space.
yeah.
I just don't, and then, often clients will come for couples therapy and I'll do my own diagnosis and assessment, and a client will get the diagnosis and then their own therapist is shocked or surprised.
Mhm.
So we have to be more open-minded
Yeah.
about the kind of the rainbow and the spectrum of ADHD and how it looks.
Mhm,
Um, and then medication's an interesting one. I think people have really fixed ideas and beliefs about medication.
mhm.
Mm, whether it's not going to help me at all or it won't be the cure. And certainly it's not. But again, I don't think we're telling people how valuable that is.
Yeah.
And I think that's problematic. I see that a lot, right?
Mhm.
That it's, and this is just my clinical practice and what I've seen it do for people, but it can be so helpful. And
Yeah.
I don't know why we're not talking about that enough with our clients. I think a lot of
Mm,
feel like I'm digressing, but I think a lot of psychologists are really kind of uncomfortable with talking
Mm,
about medication and the
yeah.
role of medication. And maybe that's not our training, but we
Mm,
can talk about what we see clinically. Another misconception came to my mind. So I think a lot of my clients, when I've done the process in the assessment, they'll call it a tentative diagnosis. I don't know if you get that, as if psychologists or clinical psychologists can't actually diagnose. I'm like, no,
mm-hmm.
no, this is it.
Yes. Yeah.
So
Yeah.
I think that's out there, that maybe there's not enough knowledge yet that that's what our profession can do.
Yeah. And it's like kind of, you mean like only psychiatrists and that can, and
Yeah.
pediatricians can diagnose.
Yes. Yes. And it's like, no, no, I can do a diagnostic assessment and interview. I can look at you from infancy to childhood, to your education, to your relationships. And I can use these measures and tools
Mm-hmm. Mm-hmm.
and be pretty confident about that.
Yeah.
Yeah. And then I don't know, I just get a lot of, it can't be ADHD, it's anxiety or it's
Mm,
depression or it's addiction and it's like ADHD can exist with all of those things. I think
yeah.
that's a big misconception. Well, if it's all of these other things, it can't be ADHD. It's
Yeah.
like, no, the ADHD is contributing to all of those problems.
Mm-hmm.
Right. And that's what I see so much. And I start to look back again on some of my clients and go, oh my goodness.
Yeah.
And it just kind of clicks like, oh my goodness, this is why. So I
Yeah.
think that's a huge misconception. Like, you can't have, if you're depressed or if you're anxious or the anxiety is predominant. It's like, no, no, this stuff can lurk under the surface. And it's maybe been mistaken as, I don't know if you found that.
Yeah. No, absolutely. That's
Oh,
anxiety and depression, if anything, is perhaps more of what the focus is been put on, and less
mm,
so on
mm,
the problems underneath
mm,
that are really just causing the anxiety and depression. For instance, it's kind of like treating the surface level symptoms and not actually
totally,
figuring out if there's other
totally.
things playing out. And yes, the comorbidity with so many other disorders is a great point. I mean, it was not until
Mm,
the last decade where we kind of acknowledged that, yes, you can be autistic and have ADHD. So, we have come some quite a decent way. We still have a long way to go of maybe
mm,
understanding truly how these kind of comorbidities exist, and not
mm,
suggesting that, PTSD can only kind of be diagnosed. ADHD is only just, a misdiagnosis. If someone presents with PTSD and things like that, or complex PTSD,
mm,
I should say, that conversation I find also really invalidating for the ADHD, is that you can have
oh,
PTSD and also be an ADHDer. And it's actually really quite common because of the RSD that you are just more inclined perhaps to interpret situations as really quite traumatic.
yeah, I think we're still in our infancy and we're learning so much. And a lot
Mm.
of these things overlap, but I think we've got to look at those distinctive parts of the ADHD stuff. Yeah.
Yeah, you brought up some good points there, and I think those are typical misconceptions that I come across as well
Oh,
in
yikes.
in our practice. It's good that we have conversations about this, and again, it comes to across
Mm,
individual counselling and psychology assessment
mm,
and
mm,
treatment, as well as in couples therapy. I mean, it
mm.
obviously shows up everywhere.
Yeah, and I think the other, the misconception is tricky is like in terms of a couple and a partner, like my partner can help this or
Mm,
they can work on it. Not necessarily. I
mm-hmm.
mean, I think it depends what the symptom is and what we're talking about, but it's not going to change overnight and certainly not without support,
That's
not
right.
without, medication and routines and kind of allowing that process to happen over time, not overnight.
Yeah, yeah. And moving away from this idea that we can just
Mm,
somehow fix the ADHD for everyone,
yeah.
but it's forever a process of managing it, which it typically is with a developmental disorder that doesn't just go away after some
Exactly,
time.
exactly. I think that, the meds and the strategies take you so far. And yeah, the other misconception is, well, it's the ADHD person who has to do the work.
Mm-hmm.
It's like,
Yes.
no, like, how are you responding to that stuff?
Mm-hmm.
How is your language? How is your anger? How is your tone? How is your irritability? How is your communication? Are you, going to them face to face, eye to
Mm-hmm.
eye, getting them at a good time? Like, help yourself
Absolutely.
to get your needs met. Yeah.
Yeah.
Yes.
That they too have a responsibility of meeting the needs of the other person, and that they need to also still be working on themselves. It's not just a
Yeah.
neurodivergent person that needs to take that
No,
responsibility on.
no, it's both. It's always both
Yeah,
in
yeah,
couples.
that's right.
Yeah.
Wonderful. Thank you for once and for all just kind of validating that. So, what advice would you offer to someone who has recently been diagnosed with ADHD or identifies as neurodivergent?
I thought this was a great question. And what came to mind, I feel like most of my clients, when they get that diagnosis and it's, there's relief and there's grief, and then they want to work on it straight away and figure it all out straight away
Yeah.
and get all the answers and understand why I did what I did and what was the ADHD and what wasn't. And just want to say, slow down. I
Yeah.
think, like, you're further ahead probably than what you think you are. And the work has already begun and the work will continue, and just one thing at a time.
Yeah.
Slow down, just work on one little thing, each week or every few weeks. And just keep showing up and trust that the neural pathways will shape and change. It's okay, right?
Yes, I love that. That is so, so great. It's such a great way of highlighting that we truly need to just slow down, take it all in,
Yeah.
and not want to do everything all at once, or you'll just end up overwhelming yourself completely.
Exactly. And the work is the understanding. I actually think that's the biggest part of the work,
Yeah.
because if I understand, then I can have compassion for myself. And then if I understand, I can begin to adjust and do things differently. And
Yeah.
it's
Have more self-acceptance.
totally, totally. And I think the other part is slow down, because it's not all up to you, as in, when I worked with kids, it's not so much what the child can do to think differently or feel differently. It's actually, how can the environment support you?
Mm-hmm.
Like, the onus is not all on you. It's like, how can the environment support you? How can people around you support you? Can you ask for help? Can you delegate? Right?
Yeah, I love that.
Yeah.
I love that kind of image of that flower within, we don't want to kind of expect the flower just to change, but to maybe
Yes.
change the environment around it.
Totally. Give it some watering and some love.
Mm-hmm. Mm-hmm.
Yeah.
Yeah, absolutely. That's such a good way to describe it. So, are there any specific resources like books, websites, support groups that you believe to be quite invaluable?
Yeah, I love, make a confession. Haven't read it all, but certainly
Okay.
halfway through. And my clients have often, like, and I tell a client, read this, read. They end up reading it before
Mm-hmm.
I do.
Mm-hmm.
But the ADHD effect on marriage, I think, is brilliant.
Yeah.
And I've had feedback from, culturally diverse couples, queer couples. It's validating for both.
Okay.
It's really okay
Mm-hmm.
what the ADHD partner has to accept and work on, what the non-ADHD partner also needs to work on. And there's this beautiful section. I just got tears in my eyes reading about all the beautiful strengths about ADHD, the creativity and the enthusiasm and, being calm under pressure. And so it's a beautiful book for everyone. I also really love How to ADHD.
Mm-hmm. Yes. On
I
YouTube,
think,
and that's great.
yeah, I think she's fabulous. She's super helpful. I
Yeah.
get lots of ideas from her. And then there's some really great. So Susan Young, she presented at the ADHD conference that I went to, and she's done some really interesting studies, and she's informed me. I've also, like, in terms of sex and sexual preferences and
Okay.
sexual diversity, I don't know the name of it, the paper, but just kind of sexual preferences and sexuality and how that looks in ADHD. And yeah, very, very helpful, because again, that I see that a lot in couples, like extramarital affairs and,
Mm-hmm.
difference in libido,
Yeah.
seeking dopamine. And
Mm.
so that's a great resource, actually.
Okay,
Yeah.
amazing. So we can link that paper, but if we can locate it or any of the
I will,
work.
Dan. I've got it. I've
Yeah.
sent it to someone.
Oh, wonderful. Yeah.
Yeah.
That'd be amazing, because I think that stuff can be so valuable as well. Like
Yeah.
some of the
And
research evidence base behind all
just
this.
so validating about, like, promiscuity and risk taking, and actually how that looks in a female population was so interesting in terms of sex and people pleasing and kind of that
Interesting.
rejection sensitive stuff. Yeah.
Yeah. Yeah, there is some good research out there, or starting to be a little bit more on females and their sexuality, being more risk taking in
Totally.
their earlier years, at that people pleasing and kind of
Yes.
seeking connection, that is actually really quite problematic in terms of,
Mm,
being taken advantage of. And
and then comes the trauma and
hmm
yeah. So we
yeah,
need to know a lot more.
yeah, yeah. And then, yeah, how that then can play out in later relationships, and around having healthy attachments with people, as opposed to
Totally.
relying repeatedly looking for that rush of dopamine, that kind of toxic love. And
Totally.
yeah.
Totally. And yeah, I didn't. It's my clients have been so helpful in terms of, I'm allowed to be curious and ask those questions and
Mm,
understand, because a lot of that dopamine seeking is not the end point, right? It's not that I get the drugs or the alcohol, it's the sex, it's the whole process that leads up. And then I understand that, and then, okay, so we can slow that down, right? Or how do I bring dopamine into your life in a way that's kind of more helpful and healthy for you?
yeah, wonderful.
Yeah.
And do you have any suggestions around what are some typical things that you may recommend as kind of healthy dopamine releases, instead of relying on the relationship for that kind of thing?
Yeah, actually, again, my clients inspire me, but I think like the walking together side by side, kind of, like, and
Mhm.
holding hands and the closeness. And again, you might have to schedule in sex and intimacy, but then also, planning the bigger events like the holidays and couples time. And I think you just have to be very deliberate and very intentional. Yeah,
Mm,
and like if gaming's your thing, go do it. Just help your partner understand it and don't get lost in it. Like, go on drives and go on adventures and listen to music that excites you. And often I go back to childhood. What did you love then?
mhm.
Right? There's often an answer in that. And then we
Yeah.
lose that playfulness and we get serious and over.
I love all those suggestions. And yeah, sometimes finding a way to do some of those things together can be a really great way, or both doing what meets your needs in terms of those kind of dopamine rushes, the excitement and whatnot.
Exactly,
But yeah.
exactly. And yeah, often, again, it's non-pathologizing, right? Actually build into couples work, doing positive stuff together. We don't just talk about what's going wrong.
Yeah.
Actually, adding that stuff in can help a couple de-escalate. Yeah.
In
Oh,
terms of,
yes.
I don't know if you're as much of a fan as
I
I
love
am.
her. No, no, I've gone and seen her talk. I love her. We listened to her sessions in my counseling training.
But
I thought they were incredible.
do you have any
Yeah.
others, but also things as
Yes. So I tell all my clients, if you haven't read Attached, you have to read Attached.
yes, amazing book.
Yeah, I love it. I think not everyone loves it. I think a lot of people feel the more avoidantly attached is a bit pathologized, but
Mm,
anyone can work on their attachment style, whether anxious
mm,
or avoidant. So read Attached. Anything by Sue Johnson, who is the founder of EFT,
mm-hmm.
emotionally focused therapy for couples. So Hold
Okay.
Me Tight. That's really
Mm-hmm.
good basic book. They're probably my two favorites. I use a little bit of John Gottman stuff.
Yes, I love Godman as well.
Yeah, because I think sometimes, and yeah, this is probably helpful for this population. You need skills, right? You
Mm-hmm.
need skills and you need
Yeah.
strategy and you need a plan. If we're too kind of dysregulated, you can't always do that attachment
Yeah.
work.
Yes.
Yeah.
I don't know if you've come
Yes.
across that one. Yeah.
Yeah. Love it. All
Yeah, it's a
that
good
stuff.
conversation starter if you're a bit worried about how to actually bring things up. I find that for
Mm,
those who either bring things up pretty impulsively, or don't
yeah.
find it hard to know when is the right time. Like, well, what about just date nights? Just creating a date night one surrounding maybe more of like that values talk. That sometimes
Totally.
seems to be helpful. But I guess I'm talking to the individual, not couples
Mm.
necessarily. But
No, I've prescribed those cards. I have another one. I think it's called Best Self.
hmm
They were on Amazon. I found them. Best
okay,
Self, like, I don't know, couples deck or intimate, Best Self intimacy deck. That's it. And they're really lovely, like to revisit the early times in your relationship or in your
hmm
individual lives. And it's just those connecting conversations.
okay,
Yeah.
great. Really appreciate it. Okay, so now I have a bit of a would you rather that I tend to finish off with
Sure.
clients at the end before we will kind of plug all your socials.
I,
Right. So now, would you rather, as a therapist, be sitting in a room and where there's just silence for pretty much the entire session and you have to do all the talking?
yeah.
Or the other option, where both of the couple are talking so much and getting kind of escalated, and you're really struggling to kind of intervene?
Well, silence, I was like, how much silence? But I'm a great talker
Hmm.
and I can do plenty of psychoeducation and I can kind of do it's a bit of the EFT, emotionally focused. You must be feeling and you're shutting
Hmm.
down
Hmm.
because, and
Hmm.
just kind of, almost voice what they would be saying. So I'd pick the silence.
Hmm. Fair. No, I can totally understand. I do find it hard when, yes, working. I should probably just reflect on myself, to be honest. When I notice myself just rambling and I'm just like, oh my goodness, like we're not getting anywhere with this. So, yes, I think using silence for myself can sometimes be good. And I can, and listening and kind of reflecting is probably a really helpful skill when it comes to, my own relationship and in therapy too. But yes, I do love talking, as you can probably tell.
Oh,
But as a therapist, it's important, like you said, it's important to be able to use reflection in that, especially when the client feels like they're going to struggle a bit to kind of
mm,
contribute.
mm.
Yeah. So I love that. Yes, the silence definitely. I can see that being something maybe easier to work with.
Totally. And my nervous system is at ease a lot more.
Yeah, yeah, yeah.
Yeah.
No, which is so fair. It can be really hard to be the one that has to be the one regulating and supporting the
Yes.
others in the room to do the same.
Totally. Totally.
Yeah. All right. Well, I would love for you to, as we've come to the end of the chat, plug all your socials and, your website and whatnot, where people can
Oh,
find you.
thank you. So if you just look up the relationships, I work in person in Randwick in Sydney, and I do lots of work via telehealth. So I
Hmm.
see my couples via telehealth. They're not always in the same place, so I can do that. And if you're interested in working on your attachment wounds, fear of abandonment, shame in relationships, I have an online women's group, which is starting on the 20th of Feb, which I'd love you to check out.
Awesome. That's great. Thank you so much. So, will you be running any more of those at another point? Or are you going to see how you go with that?
Probably. So I'm away in June, so I don't think I'll get one in before then, but definitely after, at least once more this year. Aim for 3 times if I can squeeze it in.
Yeah.
And I'll have a dating journal that I'm working on, which will come out soon. And I'm trying to finish my book and get that out.
Wow. Gosh, you're just juggling a lot of things, but it all sounds
I think we
amazing.
both are. Thank you.
Yeah, yeah. No, I can relate. Yes. So amazing. I really loved our chat. I think, you've shared some really valuable insights as a
Oh,
therapist working with ADHDers. And yeah, I think that people will find this really valuable. So thank you very much. And I will talk to you very soon, I'm sure.
you will.
All
Thank
right. Thank
you.
you. Bye for now.